Hey, what's up guys? This is Dr. Shea from Aligned Life, and today I'm going to show you 3 fantastic exercises to get rid of your plantar fasciitis and eliminate that heel pain. Let's get started! All right guys, let's first talk about the anatomy of the plantar fascia. So when we look at the foot, there's actually 3 arches that take place there. So if you check out my foot, I've got a big old foot, size 14, so this hopefully will be easy for you to see. We have one inside arch, they call it the medial longitudinal arch. There's an outside arch, they call it the lateral longitudinal arch. And then there's this transverse arch that runs across the middle there. So the plantar fascia starts way down here at your heel, and it connects all the tendons from the foot right back at this point. So if you first thing in the morning step out of your bed, like take that first step, and all of a sudden you feel like an ice pick going into your heel, then you probably have plantar fasciitis. You also may check and actually palpate this area, meaning like feel this area of your heel and feel if there's any sort of ridge in there. If there is, then oftentimes we have what's called a calcaneal heel spur. That means that the area that is responsible for connecting the plantar fascia from the bottom of your foot back into this area. This is actually grown in surface area to try to adapt to all the stress that's being placed upon the bottom of this part of your foot. So these are kind of tells that you may have an issue. Now, if that's the case, 2 things I'd recommend. Number 1, I would definitely go and look at night bracing. You can purchase a brace probably off of Amazon or something, your local drugstore, that will help to keep your foot in what's called dorsiflexion, which means that you bring the toes up. What that does is it takes the stress off of this area. So that way, when you take your first step in the morning, it doesn't cause you pain in your heel. The second thing I'd look to do is, as a chiropractor, I typically will adjust my patient's feet, and we can also potentially do some soft tissue work down at the base of the foot there, trying to open up some of the tissues and restore some of the alignment, which will bring the range of motion back to those areas. So those are my first steps. Now let's talk about those exercises. All right, guys, the first exercise that I'm going to show you is going to be using either a baseball or a lacrosse ball. I like these because they're nice and hard and they're going to be strong enough to get into those tissues underneath your foot and make a big change. So what we're going to do is we're going to actually have you work on those 3 arches, the inside arch, the outside arch, and then the arch that runs across the bottom of the foot here. So to do that, I'm going to first go ahead and place the ball right underneath the inside part of my arch. And what you'll do is you can either do this seated or you could potentially do this standing. You're going to move your foot back and forth across the inside part of your foot. Now, a lot of times you'll feel some creaking and popping, maybe a little bit of some discomfort, and that's very realistic. Remember, these tissues have been overworked for a long period of time. Then what you can do is change the ball to the outside portion of the foot. Again, doing this same longitudinal type of stretch. This is getting that lateral aspect. And then lastly, you're going to go ahead and just put your heel right onto the ground here. And I'm going to go ahead and I'm going to windshield wiper back and forth, working that transverse arch. And I love this because if you can find a spot where it sort of hurts oh so good, that's where you really want to be working. So go ahead, find that spot wherever that is. You can press down with this, give a little bit more tension. You can do just like a little bit of a pressure wave or really go for it all the way up and down, whatever feels good to your body. Make sure you don't overdo this. My recommendation is about 2 minutes and then stop. Make sure you don't overtreat this area. Otherwise, you can just cause the area to be inflamed, which puts you even worse than where you started from. So don't overtreat this, couple of minutes and then call it good. All right, so now once you've treated the area, we're gonna move upstream a bit from that. So we're gonna move into what's called the Achilles. The Achilles is this band of tissue that connect your calf with the lower part of your foot. So what we're gonna work on is trying to stretch that out. So I really like going ahead and providing some real good tension to this. So what you'll notice is I'm kind of in a crouched position. I'm going to hold the back of my heel down. And what this is going to do is as I bring my body over the top of this, I'm really going to tension right here, which is that Achilles tissue. So going in and pressing down on that as I go ahead and just gently push my knee out to this side over the top of my toe. So the more I can do this while at the same time keeping my heel down, I'm putting a really good amount of stress on that tissue and getting a really nice opener for the Achilles tendon. All right, guys, last one. What I'm going to show you is a calf stretch. Keep in mind that the tissue above the Achilles now, even further up, is going to be your calf musculature. So if we can open that tissue up, now we've really worked from the entire lower leg down all the way through that plantar fascia, which eliminates all the stress and tension that oftentimes shows up at the base of the heel. So what we're going to do is we're going to have you turn onto your hands, and you're going to drop the foot back that you want to actually put a stretch through. So go ahead and do that. Bring your whole body up into an upright position. Take your other foot, press down on that. And what you're going to see is I'm going to really exaggerate, attempting to try to get my heel all the way to the ground or as close to that as I can. And as I do that, again, I'm going to be really trying to bias this tissue that ends up living right in through this area. So if we've worked calf, Achilles, and the plantar fascia as well as the heel, now we've really got it covered. I think you're going to see a big difference with this. So wear your night bracing, get your adjustments to the feet, work on these 3 exercises, say goodbye to the plantar fascia. We'll see you later. Bye-bye.